The coronavirus pandemic has resulted in the UK reaching a grim milestone today, with the number of people dying having tested positive for COVID-19 surpassing 40,000. Britain is now only the second country in the world to reach that number after the United States. 357 deaths were recorded in the latest 24-hour period, bringing the total across the UK to 40,261. It comes amid falling numbers for new infections in the community. An Office for National Statistics study of adults and children in private households estimates 1 in 1,000 people in England tested positive for the coronavirus in the last week of May, not counting those staying in hospitals or care homes. Now, this is down from last week's estimate of 1 in 400. Well, we'll have more on the rate of infection in a moment, but first, with the very latest, here's our health editor, Hugh Pym.
For families and friends of the bereaved, some of whom spent weeks in intensive care, there have been months of grief and emotional turmoil.
My mum, she was my best friend. She was kind, funny. This is just the worst pain in the world.
I feel like without the proper protection, then more things like this and more families will lose a loved one.
Since the first UK death in early March, a total of 40,000 have now died after testing positive for coronavirus. The government's chief scientific advisor said keeping the death total to 20,000 or below would be a good outcome. It's now above 40,000. How do you assess that outcome given where we are now?
The day that the number of deaths from coronavirus has gone over 40,000 is a time of sorrow for us all. We've got to remember that each one of these is an impact on a family that will never be the same again. And my heart goes out to them all. And it makes me redouble my determination to deal with this virus.
So how did we get here? On March the 11th, the World Health Organization formally declared a pandemic. That day, Spanish football fans were in Liverpool for a Champions League football fixture. The next day, testing and tracking of new community cases was stopped, with resources focusing on hospitals. The 4-day Cheltenham Racing Festival was in full swing. On March the 16th, people were told to avoid pubs and other social venues and work from home if possible. The next day, the chief scientific advisor made this prediction.
If we can get this down to numbers 20,000 and below, that's a good outcome.
On March the 23rd, lockdown began across the UK. On the 21st of April, the daily death toll hit a peak with more than 1,000 deaths. Since then, the overall total has climbed and now stands at just over 40,000 deaths, though this doesn't include those in all settings where there wasn't a test. Some experts argue the government should have reacted more quickly after seeing what was happening in Italy.
We had 2 to 3 weeks more time to get ready for this, but I think we just took it too easy, to be very frank. I think we assumed that we were different, that somehow we were going to respond in a different way, that we could cope. And then by the time they realised they had the problem, it was too late.
The UK COVID-19 death toll at around 40,000 is ahead of other European countries, with Italy next on the latest reported figure at just over 33,500, followed by France, Spain and Belgium. But adjusted for the size of the population, Belgium has the highest death rate at around 84 per 100,000 people, with the UK at 60, a little above Spain, Italy and France. There are slight differences in the way each country calculates its figures.
This virus has hit lots of very developed nations with robust healthcare systems, robust health infrastructures, and it's taken a lot of people by surprise. And I don't think the UK is alone in having been taken by surprise. And I think we need to essentially wait till the end of the pandemic and then have a dissection of what happened and learn lessons from it.
For now, the authorities will focus on testing as many people as possible and then tracing their contacts, seen as the best way to suppress the virus. Hugh Pym, BBC News.
Well, the first case of COVID-19 diagnosed in the UK was at the end of January. The first death was back in March. Our special correspondent Alan Little now looks at the lives lived of some of those who've died.
Behind the statistics, the government charts, the number crunching, are the lives lost. Riccardo Bonsato, known as Ricky, was 54. He worked in a care home in Lancashire. The residents knew him for his kindness, compassion and sense of fun. He leaves a wife and 2 children. Ina Beaton was 103. She lived through the 1919 Spanish flu pandemic and the Clydebank Blitz. She died in her care home in the Isle of Skye. Her family said she was known throughout the island and loved its language and culture. Jamshed Ahmed Siddiqui was a florist from Hodge Hill near Birmingham. He fell ill on the day lockdown began and died in intensive care.
The consultant sat us down and said, look, I don't think he's going to make it. And then I just gave the opportunity to my older brother to hold his hand in his last moments. And then I think he spent like 3 to 5 minutes. And then I think my father sadly passed away.
Earl Fuller, known as Sam, joined the prison service after a 20-year career in the army. He was a physically fit 60-year-old. His family said he was hugely popular, always the barbecue man at parties. Christina Pole was from Hornchurch in East London. During the Second World War, she worked on breaking the Enigma Code at Bletchley Park. She kept her work secret for 40 years. She was 97. Clive Futter from Mold in North Wales had worked as an Airbus inspector. He was 78. His family said he had an amazing sense of fun and an immeasurable lust for life. Liz Spooner worked as a nurse at the same hospital in Swansea for 41 years. She was 62. Devastated is an understatement, one of her friends there said. Another dear colleague lost. Gordon Reid, known as Goggs, was an Edinburgh taxi driver. He was 68. His friends, unable to attend his funeral, paid tribute outside his local pub. He was cautious, stopping work to stay at home days before the lockdown began.
My dad was funny. We just had a huge amount of fun with my dad. He absolutely doted on his grandkids and my kids just adored him. We just had such a lot of fun. He had a huge group of friends. Everyone that knew him just loved him, really. He was a fit and healthy guy, liked going out and playing golf and just socialising with his friends. It was all just about fun with my dad, really.
Purnima Nair was a 56-year-old GP from County Durham, a wife and a mother. It's unbelievable, her practice manager said. Her heart was with the NHS and what she could do to help. She'll be so missed. Steve Lynham from Burnham-on-Sea was 44. He and his wife Denise would have celebrated their 25th wedding anniversary next year. She was also in hospital with COVID-19 and recovered. Steve was loving, caring and fun, she said. Please take this seriously. Stick to the rules. Don't go through our heartache. Alan Little, BBC News.
There has been some encouraging news today in the pandemic. New figures suggest coronavirus infections in the community are falling substantially. The Office for National Statistics says the number of cases in England is down to 5,600 a day from 8,000 a day last week. However, one study suggests that in the northwest and southwest of England, the rate at which the virus is reproducing could be near 1, suggesting infections may rise. With more, here's our science editor, David Shookman.
With people out and about across the UK over the past week or so, what do we know about the virus and whether it's under control? Well, despite the scale of the death toll, there are some signs that things may now be going in the right direction, at least for the moment. The latest survey shows how the percentage of the population testing positive for COVID-19 has fallen in each of the last 5 weeks, which is of course good news. But bear in mind that there's a very wide margin of error with this study, and also that the swab tests were carried out by people themselves. And because that's not easy, the results may not be that accurate.
I think it's incredibly important for us not to lose sight of the fact that this is a virus that is incredibly contagious, can transmit very easily and efficiently between people, and still most of the population haven't seen this virus and are susceptible, and that allows it to spread very rapidly if we let our guard down.
The big worry is that more contact will mean more infections. So what's the latest assessment about the speed with which the virus is being spread? At the height of the outbreak, the infection rate, the R number, was running at about 3, meaning anyone infected was passing it on to, on average, 3 others. The key was to get it down below 1, because below that number, the disease does not escalate. And the latest estimate is that we are, for the whole UK, running at about 0.7 to 0.9, below 1, but not falling rapidly. And if we break that down across the UK, the picture varies. One computer model shows that in most areas of England, the rate is thought to be below 1, except in the northwest and southwest, where it's estimated to be right on 1, while a different study suggests that Scotland, Wales and Northern Ireland are on 0.8. So for the moment, the advice is still to keep at least 2 metres apart. And barriers and signs have been springing up to remind people. The lockdown has suppressed the virus, but it hasn't killed it off. David Shuckman, BBC News.
Well, our health editor Hugh Pym is here. Hugh, more than 40,000 now dead in the UK, a total no one could have predicted after that first death way back in March.
That's right, Clive, 40,000, a devastating death toll. The new daily reported case numbers are falling. That's what the 7-day rolling average says. It's pointing downwards. And of course, we should remember the NHS coped throughout the early stages and the peak in April and into May. But there are 1 or 2 slightly worrying pointers. Hospital admissions with COVID-19 patients in England and Wales have moved up slightly. They are down in Northern Ireland. There's no data in Scotland. And as we heard there in David's piece, there are these issues around the regional R numbers, particularly the southwest and the northwest of England. And Thameside Council in Greater Manchester has written to local schools late today, urging them not to reopen as planned on Monday, to leave it 2 weeks because of concerns about where the R number is. Meanwhile, the Health Secretary, Matt Hancock, looking ahead to this weekend and mass demonstrations planned, he said he was appalled by the death of George Floyd, and he was certainly sympathetic to people who wish to be out there, but he said people really shouldn't take part in large gatherings, demonstrations above the number of 6 people.
OK, Hugh, many thanks. Hugh Pym there.